I think that's good.
Great.
Thank you. Beacon Community Services is a multi-service, not-for-profit organization in Victoria with services to enrich the lives of people from pre-birth to end of life. Beacon delivers compassionate, innovative community programs that foster self-sufficiency, volunteerism, and well-being. We have 265 employees and 563 volunteers supporting the community with a vision to help others, empower communities, and improve lives. Our team works out of the Shoal Centre in Sydney, a 55-plus community centre. We offer recreational activities, seniors outreach through Better at Home and More Than Meals, and seniors wellness programs, which we choose to evaluate for project impact. Our population sample size was 66, chosen from the Family and Friend Caregiver Program, Senior Peer One-to-One Support Program, Senior Wellness Support Groups, and Bereavement and Depression Drop-In Support Groups. From these groups, we chose to interview 24 participants to collect our qualitative findings and surveyed all 66 participants to gather our quantitative data, from which we had 33 responses. While we know the importance of mental health programs, we were pleasantly surprised to find that they are actually improving people's wellness and genuinely and explicitly saving lives. As stated by one participant, this support group in so many ways has saved my life and continues to be my lifeline. Another one stated, "This program has really clicked for me. I thrive in it. I think we need more of it." While we always assumed that physical barriers were something that prevented people from coming to the center, we now know the impact of mental roadblocks. One participant who attended the depression support group had a hard time coming back because she is, quote, suffering from depression quite badly. This made us consider things to put in place to mitigate these barriers, such as more check-in and reminder phone calls and/or a buddy system with another participant. We also learned that our educational programs are central to our success. Opportunity for lifelong learning increases self-sufficiency and resilience while building solid relationships with community partners. And we discovered the impact our educational opportunities have had on our participants, with one indicating it dramatically changed the way she responded to her spouse who is living with dementia. As part of an organization geared towards improving lives, we expected that people would benefit from our supportive services. But we were challenged by the finding that there may be a dependency on our programs, staff, and volunteers. Participants stated how easy it was to reach out at any time, saying, "I have the option to phone group leaders if I am having a problem with anything." There may be a risk with being too good at what we do. And this is something we should not trumpet about, but in turn ask ourselves, do we need to do a better job of building capacity in our participants to empower them to reach out to other supports on their own? We discovered that building resilience enables seniors to help themselves and in return, give help to others. Creating a community of wellness. We saw this time and time again, how participants in a variety of programs connected, called others that were absent from sessions to check in on them, offered advice to their peers in support groups, and even connected with friends as advocates, encouraging them to find support in their own communities. Our data revealed that Shoal is identified as the hub of the community, an essential support for seniors' physical and mental well-being. However, we are facing an identity crisis. Our center is housed in a seniors' residential facility, and many people think our programs are for residents only. We know we have the capacity to empower more seniors to improve their well-being through a variety of services. And people need to understand the scope of what we do in order for us to fully support the community, reaching out to those we do not know. We need to define what we do in the community to decrease this barrier, creating an accessible, inclusive, welcoming center. This will be our focus over the next year when we promote our seniors wellness programs we will be sure to get the word out about all services offered at Shoal Centre, thus supporting seniors in a holistic way. Thank you.